today and this week, guess what? This is Virginia Hospital Week. That's right. And now Hospital Week, I love hospitals, as you know, because I love my hospital, Chesapeake Regional Hospital. They have taken such good care of my mom, Dolly. She was just in there the other day, and they're fabulous. So I'm a big believer in hospitals because they bring jobs, and without them, we'd be in bad shape. So we have to keep our hospitals going and flowing. Now, this is Hospital Week, so I'm fired up because Hospital Week's an opportunity to recognize the good work that hospitals perform. They promote public well-being, supporting healthcare access. They provide jobs. They boost Virginia's economy and across the nation and right here in Virginia. May 8th through 14th, 2016 is Hospital Week, and I'm fired up about it. Patients come first is the theme of this year's Hospital Week. What a novel idea, right? Putting people and patients ahead of something else. It's a reminder that patient-centric care is a guiding principle of Virginia's local hospitals and health systems. So I'm very excited about Hospital Week because I love my hospital, and we're going to be celebrating it all week. And in honor of that, we've asked several CEOs of regional and area hospitals around the Commonwealth to come on. So we're excited about that. And joining us now is Chad Melton. Now, Chad is the Chief Executive Officer, CEO of Wythe County Community Hospital. Now, this is a 100-bed acute care hospital serving residents of Wythe and Bland counties in Southwest Virginia. And as you know, I'm a big proponent of getting the economy moving in Southwest Virginia, and we have a big audience there. It's our number one growing audience. Now, Chad Melton came to Virginia from Texas. I came from Georgia. He came from Texas, so we both had to go north, if you will. And in a previous role, he oversaw operations at hospitals in Florida, Idaho, and my home state, the Garden State, New Jersey. Chad Melton has also been recognized as one of Becker Hospital Review's 300 hospital and health system leaders to know. So he's like a bigwig there in Wythe County. Welcome to the show, Chad. Good to have you on.
Hey, thanks, John. Good morning. Thanks for having me on. And you mentioned New Jersey. I actually spent 3 years in New Jersey at a hospital there, so it's good to be on with the fellow New Jerseyan.
I know. Well, I grew up in New Jersey, born and raised in northern New Jersey. Now, which hospital in Jersey? Which area?
I was in Westwood, New Jersey, so at Hackensack University Medical Center.
Oh, you know what? I know just where that is. I went to college and played baseball at Fairleigh Dickinson in Teaneck, so it was just right up the road.
Yes, it was.
From there, and Fairleigh Dickinson University, FDU, as they said, right under the George Washington Bridge. And I was a commuter going to college. I played on the baseball team, and if you missed the exit for class, you were done because then you had to go over the bridge, and you couldn't get back. You would get back at like 1 in the afternoon. I mean, it was over. One time we had baseball practice, and it was and I decided not to stay, whatever I did, and I missed the exit, and I couldn't get back because you go over it, and then you can't get back in, and I got suspended and all that stuff, and I'm like, I missed the exit, and I was done for the day. So anyway.
Yeah, I've been there, done that. Made a trip through Manhattan myself, an hour and a half round trip to get back across the GW Bridge during peak traffic hours.
I know.
Many times.
Can't miss that exit. Now, Chad, I'm excited that you're on today to help celebrate Virginia Hospital Week in 2016, which is all week, as I said. And right here in Virginia and across the nation, Hospital Week is a time to really recognize and honor all the value and benefit local hospitals and health systems provide to Virginia. Tell our listeners about the origin and the genesis of Hospital Week.
Yeah, I'd be glad to. Yeah, Hospital Week originated really in 1921, but we were fortunate enough here in Virginia to have a bipartisan resolution sponsored by former state Senator John Watkins in 2015, who recognized Hospital Week as a second week in May. And as you mentioned earlier in your program, this year's theme for the VHHA is Patients Come First. And all year long, our staff, our team of nurses, EMS providers, physicians, executive leaders, really put our patients first. And so this year, It really is about recognizing those who put their lives aside, who check their feelings at the door to take care of our patients. And there's so much that our team does and our hospital does for our community as well as around Virginia. And we invest in our communities. We invest in technologies. We invest in the recruitment of physicians. We do research projects. We work with government agencies, such things like Ebola, Zika virus, and then something that has been brought to the forefront just recently with the opioid crisis and addiction. Every day we're looking at ways to be able to improve health care in the Commonwealth. And so here at Wythe County Community Hospital, it really is about making communities healthier. And every single day, our team members focus on what we call the 5 core values, which is delivering high-quality care, supporting physicians, creating an excellent workplace for our employees, providing community value, which is absolutely critical, and is something that I hope we'll be able to talk to more about today on the show, is really ensuring fiscal responsibility, what plays a huge role in in success of the organizations long term. And so it's a great week to be able to really sit back, recognize those who have done so much for our patients and our community.
Well, it is, Chad. And, I've said time and again on my show that people don't always think about their local hospital because it's there, right? They just don't think about it until they need it. And I think about it all the time because my mom has been ill for about the last 15 months now. And so she's been in and out of Chesapeake Regional. So it's a big part of our life right now. And they just have faith that hospitals are going to be there in their moment of need because they're kind of always there. Now, too often, I believe, Chad, that people take hospitals for granted. And as I said, my local hospital, Chesapeake Regional, has been there for my mom. She's received great care. I'm thankful for that. Also, oddly enough, the food at Chesapeake Regional happens to be excellent. I mean, this is about the only hospital I've ever been in where the food is great. But look, people do take their hospitals for granted. I mean, you go by them, you see the sign, but until you need them, you don't really think about it, right?
Yeah, I mean, oftentimes we don't. I think that healthcare and health system in general across the Commonwealth and across the United States, we're always there to take care of those who are in need. And I think people do and sometimes don't recognize that we're open 24/7, 365 to take care of our patients. And it doesn't matter if you've got a major snowstorm or if you've got other natural disasters or acts of terrorism across the country, we're always here. And I think that healthcare and health systems have evolved over a period of time, and we were there just in the past to take care of acute needs, which now we're there from birth to death. I mean, we provide the continuum from our OB services all the way to home health and hospice programs. And so we're there to take care of all different types of illnesses and ailments that may occur. And so, times of the worst need, car accidents, we're there. And so it's a great opportunity for those of us in Virginia to really continue to put things in the forefront of really patients come first type mentality. Because there are going to be things that are going to happen. That's just part of life. And so we're there to take care of their needs.
No question. And for our audience, we're chatting with Chad Melton. He's the CEO of Wythe County Community Hospital. And Chad, what you said, that really puts things in perspective about how hospitals are on society's front lines every day. And it isn't always glamour work, as you said, but it's so critical for us that they're there, like you said, whether it's a storm or whatever. And, you also said, Chad, hospitals are so valuable to Virginia economically because some of that is illustrated in the most recent Virginia Healthcare and Hospital Association annual report on community benefit, if you will. The report has some pretty striking stats about the benefits, the economic benefits, not the health benefits, the economic benefits of Virginia hospitals. What are some, assuming you've had a chance to look at that, Chad, what are some of the key takeaways from that about hospitals?
Yeah, I sit on the subcommittee for the American Hospital Association and spend a lot of valuable time with the VHA here in Virginia. And just a couple of key statistics, and we could talk all day long about the economic value that hospitals bring to communities, especially rural communities. But just a couple of key facts. There are 107 hospitals in Virginia, 30 health systems, and as I mentioned earlier, open 24/7, 365, unlike many businesses around the country. But in 2004, Virginia hospitals had nearly 3.6 million emergency department visits. That's amazing. Our hospitals delivered almost 62,000 babies. We had almost 800,000 inpatient admissions, which is extraordinary. But also in Virginia, hospital provided $2.85 billion in total community support. And so what does that include? $584 million in financial assistance. And then one thing that we may or may not have a chance to talk about is the whole Medicaid expansion. But our hospitals had a $330 million shortfall in Medicaid in 2014. And so those are a few statistics. Some other things just to cover just very quickly. Our Virginia hospitals and health systems had 115,000 direct jobs, and these come from 2013 statistics. $8 billion in payroll, $36 billion in economic activity for the Commonwealth, and we spent about $17 billion on goods and services. And so that's a lot of economic value that we really bring to the community. And if I just briefly touch on it, here at Wythe County Community Hospital, since is where I'm at these days, we have 402 employees where we did $23.7 million. And so I often ask around the community, what type of jobs do you have to create one job in healthcare, where our average hourly rate is $28 an hour? That's pretty extraordinary. And here, our hospital alone, $4.6 million in community benefits, and we are a tax-paying entity, and so we gave another $500,000 to the local municipality for schools, for roads, and other things. And so our hospitals across the Commonwealth are providing significant economic value to the communities that we serve.
Well, Chad, the challenges confronting rural hospitals today are something I've discussed many times here on my show to bring people to have them understand it. Now, we've already seen one rural hospital close in Southwest Virginia, one closed in Southwest Georgia. It's a real issue, not only in our state, but in others. And our rural communities need access to care, and they need economic development opportunity to bring those jobs, Chad. They go hand in hand. And I think that most people agree hospitals are important pillars in our economy, for our health, but they also enrich our community in many ways that people are much less familiar with. Can you elaborate on that?
Yeah, and as I mentioned earlier, I do sit on a subcommittee for rural health care, and so I am a huge advocate, and it's what I love to do. You did mention that we did have a closure here in Virginia, but we've had about 60 closures across the country.
Right.
And when you look at healthcare in general, as we're recruiting new businesses or industries to our rural communities, there's really two things that are often asked. How are the schools? What do they look like? And then what healthcare is provided locally? Because those are two key resources in being able to attract industry as well as new physicians to the market. Mm-hmm. They want to know that those things are there to be able to support their workforce and keep them healthy and be able to educate and do better for our kids than we have from our parents. And so those are extremely significant opportunities. Rural healthcare, as you mentioned on your show before, we've seen significant population declines. We've seen our payer mix go the wrong direction, mm-hmm. meaning higher Medicare, Medicaid, less commercial business. We've seen how it's had significant challenges in recruiting, family practice, internal medicine, and so we've lost some specialties. Those are things that really are impacting rural providers today as we continue to try to provide services for our community.
Chad, I've only got about a minute. Where can people go for more information?
Yeah, thanks for asking. If you go to the public will go to, and during this week, and often you can go to isupportvirginiahospitals.com to learn more. We're also on social media channels such as Facebook and Twitter, and they will give you a lot of information and give you opportunity to share our message today. And so, John, I appreciate you having me on.
Hey, Chad, that was fabulous. Thanks for being on. Again, more information. That's isupportvirginiahospitals.com, isupportvirginiahospitals.com, and VHHA.com, VHHA.com. We'll share that with our audience on our social media. Michael as well. And Chad Melton, CEO, Wythe County Hospital. Chad, it's always an honor to have you on, sir. Thanks for being with us.
Thanks, John. Have a wonderful day. Happy Hospital Week.
All right. Happy Hospital Week.